Good morning, Barbadians, residents, and visitors to our country. I start my short brief today with the sad news of the passing of another Barbadian. The deceased is an 83-year-old male who presented to the Accident and Emergency Department yesterday, and he was seen at the Accident and Emergency Department. He passed away, but the COVID test which was taken by the Accident and Emergency Department came back positive. The 83-year-old male was seen earlier at the Accident and Emergency Department back in December, 12th of December, and was discharged to the home of his relatives. And last night, or yesterday I should say, an attempt was made to have him booked into a small nursing home in the south of the country, where he would have spent approximately an hour and a half before he was taken to the Accident and Emergency Department, where he passed away. Our sincerest condolences are extended to the family and friends of the deceased. Contact tracing efforts are ongoing at the nursing home. We have a very good team of persons who've been assigned to this operation, and every effort is being made to deal with the situation, but there's no need for alarm and panic because the exposure at the nursing home would have been limited, and it is a matter that we are managing to the very best of our ability. The overall figure so far then for deaths, and I must say at this point in time that a policy decision has been taken that as long as a person who passes away and had respiratory symptoms and test positive, that we've taken the decision that we will count that as a COVID death, which means that we are now at death number 9, because the 8th case, which I would have mentioned some time ago, that is now a COVID death. So there are 9 deaths from COVID for Barbados. For the entire COVID period, we would have conducted 93,070 tests, yielding 1,156 positive cases. Of these cases, we would have had 758 cases for the month of January, and 22,815 tests would have been conducted during the same period. I would have reported to you last week, and since then, we would have done 5,850 tests with 120 positive cases. But of interest is the fact that for the last 3 days, we would have conducted 1,556 tests with 15 positive cases. The 8th death, which was reported, we did 17 tests for the 17 primary contacts identified through the contact tracing process. 16 of those tests came back negative, with 1 positive. And the positive test has been linked to the West Coast cluster. Of the West Coast clusters, or rather the clusters that we have reported, there's something that I need to say to the public. When we speak of clusters, and we've been able to do a lot more analysis because we've been able to get the results from the lab, we've been able to do some work in terms of determining the dates and so forth, and we are now in a far better position to do analysis. I'm not a scientist or a technical person, and there is indeed a technical definition which was given, I believe, by Dr. Best last week, and that is the WHO definition. But what I'm seeing when we plot all of the cases that we've had coming from these clusters for the year, when I plot them on a map, I'm seeing a picture. And what is that picture? A cluster is a construct. but is a construct that comprises a number of people, a number of positive cases. And those positive cases are spread out across the country. And I take it at this time to really reinforce what I've been trying to reinforce each and every time to all persons. That is, even if we have a vaccine tomorrow, no matter what the strain is, the normal strain or the variant, the basic principles remain the same. We must continue to protect ourselves. Each and every one of us, we have a part to play. The wearing of masks, follow the protocols. The evidence is clear that if we wear a mask when interacting with persons or in public spaces, that significantly reduces the chance of getting COVID. And the mask is there to protect you from someone who may have COVID. You need to treat every person as though they have COVID, and so follow the guidelines and the protocols that have been set out by the Ministry of Health and Wellness. All of our work will continue in terms of contact tracing. We're on the job, we're doing it diligently. It is producing the results that we want to be able to keep on top of things in Barbados. And I say to you that as long as we continue to be our brother's keeper and to follow the protocols, this will go a long way in helping us to contain the spread of COVID-19 in Barbados. Thank you. I will now ask Dr. Cave to address you.
Are facing in the community, we too face at the hospital. Perhaps more so because it is likely that ill patients will present to us. So while the public has to, as Minister just said, presume that everyone may be a carrier of COVID-19, we have to have practices in place to protect the staff and other patients at the hospital while we provide the best medical care for the individual patient. So what I will do now is briefly outline the practices that you will encounter if you have to come to the hospital. The first thing we ask is that you call ahead to our help desk, 536-4800. That is staffed by professionals, doctors, and experienced nurses who can provide first aid and direct you as to the course. It may be best not to actually come to the hospital at that time, and there may be other things that you're advised to do. When you arrive at the Accident and Emergency Department, the first stop will be the tent outside where a triage is performed. That is a procedure where we assess the state of the patient's health, but also their relative risk for COVID. This is first in the form of a questionnaire, and we ask the public please to be honest and forthcoming with all the answers to the questionnaire. This is for your own safety, but also for the safety of other patients in accident and emergency at the time, and also for our staff. On the basis of that triage, patients are directed as either to a suspicious area where respiratory illnesses and other COVID likely or possible cases are cared for in isolation facilities, or to the regular accident and emergency where there are also precautions in place to prevent COVID transmission, but obviously not as rigorous as in the suspect area. Once you have been assessed and seen by the doctor, the decision then will be to have a COVID screening test or not. There is sometimes a delay during which time we are waiting for the result of that test, but that does not hold up the medical care which is being provided to patients in need. Once we have that test back, then patients are directed then either to the isolation facilities if they are positive, or admitted to the general hospital. And in the general hospital, we also have practices and procedures to minimize any kind of spread, because like in the community, we have to be always vigilant. Thank you.
Thank you very much, Dr. Cave. Next, we will hear from our infectious disease specialist, Dr. Corey Ford.
Good morning to all Barbadians. I'm just going to give you a quick update on what's going on in terms of the isolation facilities since we last spoke. So at our Blackman and Gulf facility, things remain stable, patients are well. So is our isolation facility set up at Dawes facility. At our Harrison's Point facility, the tertiary unit, patients are all well. And in the secondary unit, we also have most of our patients well. But I really want to speak to you as to what's going on in the isolation facility with regards to primary isolation. And remember, as I spoke to you before, that this is the area where our most sickest patients are. At present, we have 9 patients in that area, and 7 of them are Barbadian. We have 1 Trinidadian national and 1 Guyanese national. There are 3 females and 6 females, ranging between the age of about 41 to 63 years of age. I will inform you this morning that 2 of these persons in that area are now ventilated. What that means is they're on a life support machine for oxygen. One of those individuals is one that I've spoken to you about before. This is a 45-year-old female, Trinidadian female, who has multiple comorbidities and remains quite ill, critically ill from our perspective. And she's on dialysis. She's a dialysis patient from previously. The other is a new one, and this particular time is a Barbadian female. She is 48 years old, and she has hypertension and diabetes as chronic illness, as she is actually quite critically ill at this point. The remaining individuals, the remaining 5 individuals are actually on oxygen. And to finish off on a relatively good note, remember I spoke to you several occasions about the Barbadian national who actually resides in the USA, who came back. I'd like to tell the public today that he's, with the help of God and the hard work of the staff there, the ICU team, Dr. Lovell, Dr. Hassel, and the assistant Dr. George, I specifically have to mention this morning, who work extremely hard with us for these patients. I would like to say and report this morning that he's actually done quite well. He's now walking around. So the minimum amount of oxygen. This is a guy who was extremely ill, so that's very encouraging for us today in country. Additionally, as I complete my statement in terms of something to the public, is to say that I want to continue the sort of measures that were mentioned before, but I also want to take the opportunity and I really, this morning, really want to thank every single Barbadian who has assisted us at Harrison's Point, including some of the patients who've been through the facility and have really given back to the facility at this point. And I encourage you as Barbadians to remember what I've always said at every single press conference, that it is our facility. We need to be proud of it and we need to contribute towards it in any way possible. There've been many clubs, there've been many individuals from 97 years old to much younger who have contributed, and I want to take the opportunity to encourage you to continue to support us as a facility and to support the workers of the facility for the sort of work that they've been doing. Thank you.
Thank you very much, Dr. Ford. Next, we will hear from Minister of Tourism and International Transport, Senator Lisa Cummins.
Good morning, Barbados. Good morning to those who are visiting with us and those who are Barbadian and resident here. We want to take this opportunity this morning to express our appreciation, certainly in the tourism industry, to the Ministry of Health and all of the health officials for working seamlessly with the tourism industry over the last week. Since last Sunday, as you were aware, we stood up a call center, and we have received hundreds of calls at that call center since that time. Along with the Ministry of Health, we have been working on ensuring that our visitors and our travelers are able to benefit from getting their test results, but we have also been focusing since Tuesday on dedicating the resources at the Dos Santos laboratory to allow for persons to travel seamlessly. We know that there have been some challenges. We know that there have been difficulties with persons still getting their test results in times, and for that, it is still regrettable. But we give you the commitment that as a country and as a government, we are working through those issues. There have been, since Tuesday this week, over 234 persons who have been able to come to the Dos Santos lab to benefit from a combination of PCR tests for outbound travelers who are moving out to Canada, and for those travelers who are moving out to the UK. We are very appreciative of the partnership with our airline partners, the British Airways team, the Virgin Atlantic team, who have been able to work with us to get communication out in collaboration with our call center team to all travelers moving from Barbados to the United Kingdom. And they have been able to benefit from rapid testing, antigen testing specifically at the Dos Santos laboratory. There have been approximately 234 persons, as I said, and of that number, there were 145 visitors, including visiting Barbadians and returning nationals. In addition to those persons, we also have had 89 locals who have been able, as a result of the introduction of additional testing support, to get their test results and to have an antigen test provided for them if they were quarantining in hotels, and in some instances, in collaboration with the Ministry of Health, those persons whose businesses were closed as a result of positive cases, and they had spent the requisite time in quarantine and were therefore able to benefit from release. There are also additional arrangements being put in place to facilitate those persons who will continue traveling throughout the course of the coming week. We will have an additional facility stood up during the course of this week, and we will make an announcement on that to allow for those persons. But I believe you have heard from our Prime Minister on previous occasions in other press conferences that our traveling numbers and our visiting numbers through the Grantley Islands International Airport are actually significantly reduced, despite this being a high season, and so the volume of travelers is significantly less than the number to which we would have been accustomed. Finally, I would wish to make reference to those persons who are traveling outbound on the Caribbean flights as well as the Canadian flights, and to urge you to make contact with our call center at 628-4150 so that arrangements can be made for you in time to fly out with a negative PCR test result and your required certification. 628-4150, or contact us at any of our numbers. Most of you have been calling us. We have been working with you via your social media postings as well. And if there are any challenges, please feel free to make contact with us and we will facilitate you. We're committed to continuing to ensure safe travel, smooth travel, efficient travel, even though we're dealing with the challenges that have been brought by this latest surge. Thank you very much.
Thank you, Senator Cummins. Now we will hear from Prime Minister, the Honorable Mia Amor-Motley, who will give you an update.
Thank you very much, Ms. Morris. Good morning, Barbadians, and all of our visitors. I want to thank you for joining in and listening to us this morning again as we do a regular update. As I indicated to you on the last occasion on which we spoke, it is our intention to continue to keep you abreast as we are kept abreast. I want to thank the Minister of Health for his update this morning, and Dr. Ford and Minister Cummins. And I also have Dr. Bess here should he need to respond to anything once we open up to the questions. Let me first of all say that the first thing that I want to speak to you about is the thing that I spoke to you last about, which is our lab. And since we have spoken, the truth is that significant progress has been made with respect to the lab. As you just heard from Minister Cummins, persons who have reached the 10-day point, as we agreed on the last occasion, Dr. Best spoke to it, I did, Minister Bostic did, we would be giving them the rapid antigen tests, and that has been going on since last week, Friday evening. And every day, we've been literally clearing people out of quarantine who were there before the 10th of January. If you recall, that was the deadline that we set ourselves, and starting the new categorization from Monday, the 11th of January last week. As a result, today is the last day that we will be taking persons who have not come in yet. There was a complication, I believe, with some persons coming out of the St. Philip Polyclinic whose results, for whatever reason, were delayed, and they too have been tested and will continue to be tested along with those who have come in from the 10th of January. With respect to where we are since the introduction of categories, I'm happy to report that even as we speak, the majority of persons who have not yet heard will be hearing today, largely because the lab has completed over the course of the last few days over 3,100 tests. But more importantly for you, on the last 2 days, what remains are the Category 3 and the Category 4 tests from the 18th and the 19th of January. 18th being Monday this week, 19th being yesterday, Tuesday. Indeed, to contextualize it, we received 1,054 tests on Monday, samples, and we completed 854, and we received yesterday 570, and we have completed 210. What remains, as I said, today to be done would be the remaining samples for the Category 3 and 4 predominantly, as well as we speak, they're entering the data on the spreadsheet so that the certificates from the work done over the last 24 hours, where there really was a massive push, can be communicated to all of the persons during the course of today. I want to thank the two teams who have been helping the doctors as well. Once the certification takes place, the two teams led by Captain Beckles, as well, formerly from the BDF, and also Minister Cummins' team from the BTMI, who obviously have been there dealing with our visitors. I know what I'm speaking of because I've spent 5 of the last 7 nights in and out of the lab, making sure that we can deliver on these issues. This has been a difficult time for the country. It's challenging, largely because the explosion in the numbers of tests, you heard Minister Bostic speak to them just now, and we have had serious difficulties with some of them, but we've been able to respond adequately. We've also been able to work collaboratively with our partners locally, regionally, and internationally, and for that I want to thank, starting first of all with PAHO and the WHO. Once again, you saw Minister Bostic yesterday receive significant amounts of rapid antigen tests and PPE from the Pan American Health Organization, which came in on Monday. We also would have received from our friends in Guyana significant volumes of tests as well as reagent. And this is what happens when earlier in the year Guyana had run short, we had sent tests to them too, so that we've been working very much in a collaborative fashion. Last time I spoke to you, I think I spoke about Dominica and Grenada working with us on that occasion, and this is the kind of spirit that we want to continue. We will get 2 new machines we expect to be shipped to us next week, but in addition to that, there are 2 new labs that are going through the regulatory process. 2 new, one private sector related to a hospital and one independent of a hospital. And they have been in deep discussions with the Ministry of Health in order to amplify those processes. As you heard from Minister Cummins, we have new travel arrangements and restrictions from different countries from among our source partners. And that has put obviously tremendous difficulty, particularly with the one that was introduced initially by Canada, which had no lead time, and therefore came without the appropriate separation and categorization that we would have wanted and expected. Having introduced the categories for the first time last Monday, are we 100% happy with how they're working? Not fully. But are they largely working and much better than we were without the categories? Yes, they are. And that's why I said that what remains for the 18th and the 19th are the remaining 200 tests for Category 3 and 4, and for the 19th, it would be 360 for Category 3 and 4, which is yesterday. And what is Category 3 and 4? Again, just to remind you, Category 3 and 4 Category 3 is secondary and tertiary contacts. In other words, not people who were in direct contact with anybody at all to do with COVID. And then Category 4 are persons who, out of general curiosity and for their own sense of well-being, say, you know what, I want to get tested. I feel I need to get tested. And while we appreciate the need to encourage that, the truth is that we have to focus first on our Category 1s, which are our primary contacts. You heard Minister Bostic speak, for example, to the primary contact tracing for the gentleman who regrettably passed on Sunday, and I extend my sympathy to his family as well as to the family of the one who passed last night. But the bottom line is that those are our primary concern. Primary contacts, persons who are within the healthcare sector or who are within law enforcement and security, persons who are within the vulnerable category of persons over 75, and indeed we indicated also our border security personnel and prisoners and prison officers. Category 2 are our visitors, either inbound or outbound. And as we indicated, luckily for us with respect to Category 2 outbound, the United Kingdom and the United States of America have both agreed that they would accept rapid antigen and rapid PCR. I am told that there's a lot of discussion as to why we are not doing that locally. Let me say we are using the rapid antigen test, as we said, for persons beyond day 10. We are using the rapid antigen test, as I'm told by Dr. Ford and others, to be able to identify persons who may be positive, who are symptomatic. But the fundamental flaw with the rapid antigen test, as I've been advised, not just locally but internationally, is that even if you test negative with a rapid antigen, comfort levels will require that we do a PCR test thereafter to validate that that negative is a true negative. But where it does help is for the early detection of persons who are positive, and Dr. Ford has told us over and over and over, the earlier we can get the patients, the better that we can be at making sure that they recover. So my friends, that covers that aspect of the lab. I expect, therefore, that we should be back on track. We are obviously always challenged by the numbers that we're dealing with, and therefore this is a daily exercise, and the Ministry of Health, along with the Ministry of Tourism, along with the Ministry of National Security, will stay on top of it, and the Chairman of the Cabinet Subcommittee, Minister Walcott, on a daily basis has also been assisting in ensuring that these multiple departments and ministries work with a single purpose. As I said, I myself have not been detached from the process. I've gone down there 5 of the last 7 nights. These people are working beyond the call of duty, and I really, really, really want to thank them. And I must say to you that we also have a number of persons who are working elsewhere, but who have agreed to come in and also give a shift or half of a shift at the lab in order to help us break that backlog. Without prejudice to all of that, we will expect the Cuban doctors and the Cuban lab technicians. I believe I've been told by the Ministry of Foreign Affairs that they will come on Friday, which is day after tomorrow, and we expect the virologists to actually be on island from Paho by early next week. But what has been good is that we have been working with him over the course of the last week, 10 days, and as a result of that, there have been significant improvements in the efficiency output of the lab, particularly through pooling and other things, mechanisms that they have used. My friends, this is a marathon. This is not a sprint. And I've asked us to remember that if we just stay the course, and I know that there's COVID fatigue. I know that people are tired. I know that you feel as though you would just like to go to sleep and wake up in a fairy tale and all of this is a bad dream. I get it. All of us get it. But the bottom line is we are not yet there. We are seeing light at the end of the tunnel. We know what we have to do. And you may say, wait, they're going to tell us again about masks. We're going to tell you again about masks. Why? Because at the end of the day, if you go into a room with a person who has COVID, your chances of catching it are high if you go and stand up right next to them. Your chances are high if you go and put your hand on your nose, your face, your eyes, your mouth. But if you take the time and you say, hold your distance, if you take the time and you wear your mask, even home at you when you got visitors, okay? If you take your time and you wash your hands regular or you sanitize regular, instead of being 100% likely to catch it 10 out of 10 times, you would probably reduce that to 1 or 2 out of 10. And that is the point that these doctors have been trying to tell us. And I'm appealing to us to just continue to stay the course, because the best defender of your protecting yourself is you. The government can do all that we want to do to set the rules and set the context, but it comes back down to 1 + 1 + 1 + 1, or as the old people say, and have learned for a long time, that one blows kill old cow. Why? Because the power of agency and the power of action lies in each and every one of us. I want to address quickly now the fact that I am happy that the Ministry of Health has moved expeditiously. It is regrettable that the gentleman who passed would have spent 90 minutes at the nursing home, but we are not taking any chances. We've gone in this morning and asked for the rapid antigen test to be done initially to ensure that anyone who is symptomatic can be immediately provided with the treatment that they need. But because it was limited and because it was only yesterday, they are going to have to continue the testing over the course of a few days out of an abundance of caution, even if persons come back predominantly negative today. And I think all of us know the drill with respect to that. It is why the Ministry of Health would have had restrictions on visits to nursing homes and hospitals initially. It was relaxed at one point, but mercifully, I'm told by the minister, they had reintroduced it in December, and for good reason, for moments such as this. So I know it is difficult, I know it is hard, but we're only doing this to protect as many people as we can. With respect to the issue of community transmission, I, like you, am a layman. As far as I'm concerned, there is some level of it's all over the community, but I accept when the doctors tell me that that is not the classic definition that is used by the WHO. And they need to use that classic definition, if only because when the world is interpreting the results, they cannot interpret apples and oranges and passion fruit and grapes and guavas. They've got to interpret one. And one definition allows them to be able to compare and to be able to set policy. So for our purposes, we need to take care, because we don't know who has and who doesn't have it. For their purposes, they need to file and record in accordance with what the rest of the world speaks, because there's no sense us speaking English and the rest of the world speaking Russian or Mandarin. So I think hopefully that puts that in context. With respect to the issue of persons, and I want to speak to this, and I've asked Dr. Bess, who has done a wonderful job along with some of his colleagues in going to speak to different groups of employees and employers so that they can get context, because there is still a sense that because a person walks into this room with COVID, that you're going to catch it. And therefore what that has done is put an inordinate burden on the testing capacity of the country, because more people are being sent to be tested than really ought to be. And if we take the guidance from the public health officials, then they will be in a position to tell you yes or no, or who is primary or who is secondary, or what kinds of things. So that even though you may have a business, and the classic one I heard was entity closing because 2 businesses next door to it had people with COVID. Now, with the best will in the world, you can't stretch over and pull the COVID in you so. And if persons are wearing the mask and wearing the visors, then they are appropriately protected, and the public health people will tell us who is on the front line with respect to having to be tested. So, pursuant to that, I spoke to the head of the private sector, Mr. Ed Clark, and we've agreed that Dr. Best will address the private sector, that he will be recorded so it can be replicated for those who would have missed it. We've also agreed that he should do the same thing should the unions want it, because clearly it is both workers and employers that are needed to be provided with this information so that they have a sense of comfort. Regrettably, we are in a stage where we have to work and protect ourselves, but going forward, recognize that, as I keep saying, if this was the only issue Barbados had to deal with at this point in time, much of the debate and much of what is being said would be absolutely relevant. But we don't have the luxury of a single issue in a country. We have still to deal, and you heard Dr. George yesterday speak about the issue of dengue fever and the fact that we have lost persons to dengue in recent times, and what we must do to ensure that that doesn't come out and get out of control either in this country, because that will put an inordinate burden on the hospital systems, as it has already started to do in some instances. I know, because I've had family who've had dengue over the course of the last few weeks. And in one instance, one had to be hospitalized. So believe you me, these are not easy issues. At the same time, we have the very real issue that there are still too many Barbadians who are not yet working, and that is why we're having to carry them. Everybody deserves to eat. Everybody must eat. Everybody must be able to live. And it may not be what we want, but we have to address first what we need. And once we can address the needs of all Barbadians, then we can move forward with the calm assurance that this country will make it, as I have the confidence that we will. I must, however, pause at this stage to have some frank conversation with us, because the bottom line is that, and the government is sympathetic, as you would have seen with respect to the workers at Harrison's Point and the QEH with the hazard pay. And I get it. But what I don't get is persons sicking out when we are still awaiting the union submitting the claim. The government does not know what the claim is. And with respect, we can't respond to something that has not been submitted. So that once that claim is submitted, Minister of Health has already met with the NUPW this week. But I want to suggest to the NUPW and to its members, let us make sure that we are not clouding this issue with the very difficult issue of the new appointment of a General Secretary of the NUPW, because it seems as though this issue is being fought more in the media than in the boardrooms and the offices of the public service, where it ought to be fought. The bottom line is that we have responded more to the terms and conditions of nurses and medical personnel more than any other government in recent history. We've also provided more additional nurses. We've brought in 100 from Ghana, as you know. We've hired more who are available to be hired. And we've also looked at creating a special category for those who want to stay in nursing and who don't necessarily want to go into administration. Now, have we done everything? No, we haven't. But you can ask the customs officers, you can ask almost every category of worker in this country. We have bent over backward to facilitate and to be able to look at general terms and conditions. But I issue a warning. At some point, the Minister of Finance is going to have to step in. And at some point, the Minister of Finance is going to ask you, how are we going to pay for all of this? And at some point, the Minister of Finance is going to have to make sure that the balances are there, because what we will not do is topple this country over. Now, let us also be real. There are large numbers of persons who are not working, who are now being carried by the central government, whose revenue, far from increasing, has significantly declined. And when we also want to address it, let us remember, as I discussed last week, the antagonism towards visitors is worrying, because that is what pays our bills. And if we want to be able to increase the amounts that we give to persons for hazard pay, then we have to earn it from somewhere. It is the same pot. And the Minister of Finance has asked me to assure the country that it is the same pot. So that if we have a difficulty in understanding that, then I want to be able to open the books. Now, by the same token, I get it, and I want to give some level of hazard pay. But I'm putting you on notice that the quantum can only be what the traffic can bear. And the traffic at this stage has had a 90% reduction in tourism. And I'm going to ask Dr. Greenidge to speak to the country this weekend on what are economic realities. He started last night on CBC. I want him to continue, because I think sometimes that people are so focused on what we are doing with respect to COVID that they have forgotten that we are still having to manage a country with all of its multifaceted difficulties and challenges and benefits and opportunities. But it is a country that is complex. And therefore, I want us to literally remember that if those who have can't help us carry those who do not have, then like with COVID, all of us are at risk. Those who have must help carry those who do not have. And if we have to do it through government, then government is restricted to the same pot. to help now those who don't have, who had a year ago, as well as those who have and are working but want more. We will give more for the nature of the hazard, but we cannot give beyond what we don't have. And I don't think any of us want to go back into a hole where we are incapable of coming out. As a result, it means that I've suggested to the Minister of Health that there has to be a division between those who are COVID frontline workers, like at Harrison's Point, like those who are doing the swabs, and those who are in the background necessary for the preservation of our health system or different aspects of our economy, but who are not necessarily facing the same level of risk as a healthcare worker or a police officer. And there are others who face it, so don't get me wrong, but by the same token, if we don't moderate, we are going to find ourselves in trouble. And I simply say to those who are wanting to take industrial action without putting the requests on the table, that is not how we do business in this country. And that once the request is legitimately put on the table, we will deal with it. This is the same country, for example, where a government came in and literally on the eve of an IMF program increased salaries by 5% when the last government had not increased it for almost 10 years. So that know that I will always be straight with you. We will tell you what we can afford, and I will also tell you what we cannot afford. And then we will also remember that adults understand, unlike children, that choices have consequences. And we as a people, through the social partnership and elsewhere, will determine what we want to do. My friends, I know today is a special day for others who want to go and watch something else. So I'm going to come off your camera very fast and make this open, available to questions. We're not going anywhere. We're here. I think that the mere fact that every time we have anything of major import, Jeffrey comes to you, others in the Ministry of Health come to you, I come to you periodically, should tell you why we continue to ask you to ignore fake news and to ignore rumors, because all that is doing is causing panic in the society unnecessarily. And believe you me, COVID gives us enough to panic about on natural days, far less fake news. It is a challenging time. What more than anything else we need is calmness, stability, and people just stepping back and taking it easy, because this reminds me of watching a fast bowler who is lethal coming in at a batsman, and the batsman wondering how I can get through this. But guess what? The fast bowler can't bowl all day. So at some point, the fast bowler going to come off. Well, if COVID is the fast bowler, we are closer to the end, we believe, than we were to when it started. But it requires that we remain focused and keep our eye on the ball, keep doing all of the things that we know we must do, and recognize that we will have challenges across the society and across the economy going forward. I will be meeting hopefully next week with the tourism people, but I believe that they need to meet with the Minister of Tourism first, as well as the persons from the BEST program. And then once we have the clarity on refining some aspects of that, then I will meet with them early next week to see where else we go with ensuring that we keep the sector that pays our bills alive, recognizing that it is now being terribly hit by this new set of this new wave that has taken grips of the entire world. Barbados is not alone. Look at not just the rest of the region. You heard the Director General of PAHO indicating that the Caribbean is going through a very difficult moment now, not just Barbados. But equally, we know from our television cameras that the United States of America, Canada, the UK, Europe, Latin America, they are all doing it. It is up to us to stay focused and play our part. I have the confidence that we can do it. And with that, I now ask if there are any questions. Mr. Morris, I think you can coordinate. Ministers Bostic and Cummins are here, and if necessary, Minister Walcott is here too, but I think we've covered most of this stuff. We'll talk about the vaccines another day. The orders are being put in. This is, as you heard from the Director General of the World Health Organization, this is a great moral catastrophic failure, and we are trying for small countries that do not have the capacity to influence the market to be able to benefit. I spoke about the African Medical Supplies Platform who have created an opportunity for Caribbean countries, for which we are grateful. And we are also waiting for more information on COVAX, while each of us is also seeking to put in and negotiate orders on our own. But there is a global supply issue that we are managing, and therefore it is likely to be phased as to how it is delivered when it starts being delivered. Thank you very much.
Thank you very much, Prime Minister. Ladies and gentlemen of the media, we will entertain your questions now. Just by way of advice, since not everyone has their name attached to their device, we'd like everyone to identify yourself when you come online, but at the same time, we'd prefer very much if you would turn your cameras on so that those who are responding can interact with you directly. We'll take the first question.
Good morning, everyone. This is Barry Ali from the Nation newspaper. My first two questions are for Dr. Cave. Good morning, Dr. Cave, if you can hear me.
Good morning, Barry.
Hi, Dr. Cave. I listened with interest to what the Minister of Health said as it relates to Barbados officially recording the deaths of these two gentlemen. Condolences to them and their families as COVID-related deaths. But I want to ask you a question. When the postmortems of these two gentlemen are completed, can we, in a medical context, see a cause of death changing? In other words, a postmortem of these two gentlemen later now show that they could have died to, let's say, complications due to renal failure, complications due to cardiovascular disease, complications due to any of the comorbidities that would have existed and that they would have been known sufferers from. And in a medical context, if that cause of death is determined, can we as a country ask for a review of our COVID-19 deaths and say, well, these two deaths, even though these gentlemen died and were COVID-19 positive, their cause of death was not COVID-19?
Thank you, Barry. The first thing to be clear on, I cannot comment on any individual cases or give any information that can be extrapolated back to those individuals or their families. You know, it is an essential tenet of medical care that we maintain confidentiality. Now, there is perhaps a lay confidence in autopsies as finding a definite cause that may not be borne out by the medical practice of autopsies. We can't always decide between two or three different factors. We would already know in some cases that there are some comorbidities like diabetes, renal failure, hypertension, whatever. And we would also have recognized that there was COVID as well. Now, what was the actual main factor? I'm not sure that autopsies can always sort that out. And I also have to say that internationally and also here in Barbados, in the era of COVID, autopsies are restricted in practice because the practice of an autopsy can become an aerosolizing procedure depending on what they do. We do have to take legal guidance from the coroner where certain conditions apply, but as a general practice, we may end up with a list of contributing factors, not the main one, and therefore not answer your question as to the only cause of death in the kind of definitive way you might want.
Good morning.
Therefore not answer your question as to the only cause of death.
Good morning, everyone. This question, well, would either be for the health, probably for the health minister or Dr. Cave, in relation to the patient that passed away. We are getting some reports that there was actually a situation at the Vauxhall nursing home. I'm just wondering if anyone can confirm that if there was a positive case there and if this might be the death, since I remember hearing the minister say that the home was on the South Coast.
The question, can we have the person who is asking the question identify themselves and perhaps come on camera?
It is Wendy Burt. Yes, it is. For some reason, my camera is not connecting at this time, but I think everyone remembers what I look like. Good morning to you, Lieutenant Colonel Bostic. The question was whether or not we have had a confirmed case at the Vauxhall Nursing Home. I know the facility used to be run by the NAB. You mentioned that the nursing home was on the South Coast as well. I'm just wondering if you can confirm for me whether or not there have been any cases at the government-run Vauxhall home.
What I can say to you, and thanks for the question, is that it is not the Vauxhall nursing home, but as I said, a South Coast or a nursing home in the south of the country. But just as we do not give out names of patients, we also treat to institutions in a similar fashion. But just for clarity, this person is not connected or identified with the Vauxhall nursing home.
Okay, thanks so much, Lieutenant Colonel Bostic. If I may ask a question now of the Prime Minister with response to the hazard pay issue and the NUPW situation. You mentioned that it seems to be an issue which is being fought in the public concerning the whole General Secretary position. However, there have been some ongoing issues for quite a while at the geriatric in particular. And I'm just wondering between yourself and Minister Bostic about the rectification of those issues, as well as, yes, I know the NUPW is to handle the document, but does it look as if we're in a position to help handle that hazard pay at this point?
The government has been very clear that we will enter into bona fide discussions with anyone. We have reached conclusion with those discussions with the same union with respect to the QEH at Harrison's Point and the hospital itself. We continue to be welcoming to any kinds of discussions with workers of this country. They're our workers, they're not foreigners. But by the same token, I'm also being very frank when I tell you that you can only carry what the traffic can bear. And if the traffic can't bear it, then what can happen? We're going to pop down together. So let us be very clear that we are reasonable people. If the proposals are reasonable, we will look at them. But what I can say is that in fairness, there has to be a distinction between those who are on the front line of COVID genuinely with respect to swabbing or with respect to medical treatment or with respect even to the labs. I mean, I've seen firsthand what these people have been doing in the labs flat out with 3 and 4 and 5 hours sleep. So I am sensitive and empathetic and will do it. But I'm also saying that the Minister of Finance may have to later in the year look and see how we're going to close the gap between what we're spending and what we're earning. And the one thing I will never be to this country is to mislead you or to make you feel that it is just the sensationalism of politics is what is driving this. It is not. It is the reality of keeping this country stable. We brought it from the brink of economic peril, where we were literally falling over a cliff with less than 400 million in reserves and with debt that was unsustainable, being paid 68 cents out of every dollar going to debt service. We've been able to bring that down to 22 cents in every dollar. We've also been able to bring and put our reserves at $2.63 billion, which is almost 7 times what it was when we inherited it. We've had to take on a little more debt in the last few months to help us carry, because you've seen the revenue drop completely from the tourism sector. Tourism generally would be responsible for providing in this economy at least $2.3 billion a year. When we get the numbers this year, I expect it to see a significant drop off from that, because as you heard from Dr. Greenidge last night, we've had almost a 90% decline in visitor arrivals in Barbados, and therefore there will be a corresponding reduction in the volume being purchased from the farmers, being purchased from the traders in town, for the truck drivers to deliver. I went through the drill last week. Okay, so we are open to discussions, but we need to have it in writing, and we need to conduct it in accordance with what the traffic can bear. And we're sympathetic and empathetic, and will act accordingly.
Minister.
Say ultimately, sorry, just a minute. I think ultimately, because someone reminded me that Mr. Clark is in the papers today also talking about it from a private sector perspective. So I think we're going to have a social partnership meeting probably next week sometime to begin to discuss it. I think that all of us are empathetic and are grateful to the people who are on the front line. Believe you me, and especially me, I know it. I've seen it firsthand. But we equally have to be realistic with what the traffic can bear. Thank you.
Good afternoon, Sharika Griffith from CBC. Can we get an update on the rollout of the electronic monitoring bracelets? How have that been going?
I think Mr. Chapman normally deals with that. He isn't here, and Minister Bostic, perhaps you want to speak to it and see if you can update, or if not, arrange for Mr. Chapman to speak to the media later today. Go ahead.
Arrange for Mr. Chapman to speak to the media, but I can tell you that the bracelets are being deployed and utilized from the airport, and also to assist us in relation to quarantine, and those that is directed by the Ministry of Health and Wellness, but they're utilized. We have enough, and I think that once I get Mr. Chapman to speak to you, he would be able to give you the specifics, but they're deployed and they're being utilized.
As it relates to the All Years Night events which were canceled, has there been any further progress on how the reimbursements will be done to event promoters?
Ask the National Cultural Foundation to be able to put a framework in place. I think that they've been collecting the funds, but like with most of these things are not processed overnight, because the government still has to do its due diligence to ensure that we are paying what we're supposed to be paying. So that I've seen persons commenting, and I get it that stories have to be written and people have to think, but equally we have to put back into context with the systems that we have in government and the due diligence that has to be done to investigate the claims. Once those claims are investigated, the government will pay. We're not going nowhere. We ain't running away. Thank you.
Sorry, good afternoon. Janelle Reddy, Thornhill from the Barbados Advocate. I want to ask Minister Bostic a question, and it's in relation to the nursing home. The last death would have been someone who was in the nursing home for a short period of time. Is any consideration being given to working with the nursing homes to up their protocols so we don't have a situation like this again?
Yes, we have been working with the nursing homes and the same protocols that we apply across the boards within the hospitals, district hospitals, psychiatric hospital, they apply at the nursing homes as well. The same measures in relation to visitors, they apply at the nursing home. And I am confident because, remember, we've been going for several months now, and we have not had any issues in relation to nursing homes. This particular situation is a one-off situation, and we are dealing with it, and we will give all of the support. We have people on the ground, people at the nursing home. We are doing whatever we have to do to be able to assist them to get the home back up in operation, because obviously we're still swabbing persons and so on. But there's no challenge at this point in time coming from the nursing homes.
Good afternoon. Emmanuel Joseph here from Barbados today. Madam Prime Minister, you continue to say that one blow kill the old cow. Don't you think that that is what will happen to Barbados if we continue to allow visitors from high-risk countries to come into Barbados?
Next question, Emmanuel.
I didn't hear the answer.
I said no, sorry.
Oh, okay.
Thank you.
Thank you.
I have a question for Minister Bostic. This is Barry Allen here again.
Great, thanks. I notice you're getting gray like me, but go ahead.
Minister, 6 months ago, there was a level of confidence in the country. We were getting all the imported cases in, we were getting people in isolation, we were getting recoveries. There were no deaths. And there was a level of confidence within the Barbadian society that we had a good grip on mitigation and containment of the COVID-19 situation. There's a feeling now that we have lost the stranglehold and that we could be on the verge of losing the battle. What do you have to say to Barbadians who have lost confidence or are losing confidence that we have lost that stranglehold on dealing with this situation?
Barbadians may be losing confidence, but I can also say to you that there are a lot of Barbadians who still remain confident in the officials of the Ministry of Health and Wellness and the work that we are doing. As the Prime Minister would have said earlier, there's a lot of fake news circulating. There are a lot of people who are creating panic and fear in the country. The same team that has been doing this work over the last several months is the same team that is working on the issue right now. We are in an environment where there will be cases, where there will be surges at times. This is happening all over the world. It's up and down. And so it is not a matter of losing control. The protocols we have worked very well for us. The method of contact tracing and testing continue to be successful and useful. We have a particular problem now which we're dealing with, and I would like to assure all Barbadians that the team is on top of this. No matter how difficult the challenges, we will overcome. We have demonstrated that over the last several months when other countries were experiencing what we are experiencing right now. We were not. But this too shall pass because we are going to wrestle it to the ground, and that is what we've been doing. And I am sure that in the coming weeks that we will be able to demonstrate clearly exactly where we are, and you will see from the numbers that are being tested and those who are testing positive exactly where we are heading. If you start the year with almost 200 cases and you had 700 cases for the month, and then for the last few days you're down to 16 or 17, which is not an indication that it is over or that we are out of the woods, but it's certainly a suggestion that we are on the right track and that we're doing the right things. And I don't think that people should lose confidence in the team that is working and that has kept us safe for so many months, because like every other country and region around the globe, we are having a surge at this moment, but it's a surge that we are doing everything possible to manage. We have a lot more resources that have been made available to us to deal with it, and I can tell you that we are dealing with it.
If I may also, Barry, if I may, please, I wanted to just reinforce what the Minister would have indicated and ask us to keep context in mind, Barry, and that's part of the responsibility of both us as well as the rest of the society and the social partnership and even the media. Because can we say that we've lost it in Barbados? We've had 9 deaths. 9 deaths are too many. But in the context of a world that is on the verge of facing 100 million cases and 2 million deaths, I think that we continue to hold our own. But if you go back to every speech that I've made in the last 10 months, you will hear me say one phrase, another good Bajan phrase, "When catch you in pass you." And I said it over and over because I kept saying that we are as good as we are vigilant daily. Now, it is easy for everyone to step back and ask all kinds of questions. This is a global pandemic, and Barbados is an island that cannot survive on its own. And to that extent, therefore, it requires not just the government being vigilant, not just the doctors and medical officials and lab technologists and everyone being vigilant, not just the police and border security and soldiers. It requires each and every one of us joining this army. And this army is the army to fight COVID by protecting first and foremost yourself and then those in your immediate circle. So I think that has to be contextualized. Obviously, the very nature of the pandemic was always going to involve spikes, was always going to involve waves. And those who are infection specialists like Dr. Ford can give you a full interview on the character and nature of these pandemics. If there is one weakness I believe that Barbados and Barbadians continue to suffer from, particularly in the last decade, it is that we have dropped the ball on public education. And that is why you hear me going back all the time and saying we need to educate Bajans. There's some Bajans who don't know the difference between a member of parliament and a cabinet minister, and they feel that every member of parliament is a cabinet minister. There's some Bajans who don't know the difference between parliament and cabinet, or who don't know the difference between a ministry and the law courts. There's a lot of confusion as to who does what and what has. And what does it come back down? To education and civics education. And I've spoken to the Minister of Education about it, but I've also been meeting with the Ministry of Culture, because I believe we have a duty to do, and the Ministry of Public Affairs, we have a duty to do stronger public education, so the kind of discussions that we need to take place nationally can take place in an informed way. Thank you.
Thank you. And the second question for you, Minister, Mr. Bostic. Barbadians had become very, very accustomed to the Ministry of Health disseminating its dashboard and the numbers being shown in the past couple of weeks. And notwithstanding, we understand that you guys had to put more resources in and stuff, and the communications team was brought to the fore. But there's a concern that the numbers are not coming out every day or even every 48 hours. Is there anything being put in place to alleviate that, Minister, so that Barbadians can actually get a dashboard and the COVID-19 numbers, if not every 24 hours, every 48 at least?
Yes, I know that the dashboard was absent for a few days. That is true. But we were trying to make some corrections in terms of some of the information that we were presenting and how we were presenting information to the public. But you were getting the figures almost every day, not necessarily through the dashboard, but either by a ministerial statement, a statement, a press statement, press release from the Ministry of Health and Wellness, when there were no press conferences scheduled, that were giving you the daily figures of positive cases, of tests that were conducted, of persons being released from isolation, and that sort of information. And we've been sharing that with you on a very, very regular basis. So even though you might not have seen the dashboard for a day or two, the information has been made public. And I think that once you follow everything, it's not one, we're not on a one-track thing here, but we present the information as soon as we are able to present that information. And if we miss a day in information, we give 2 sets of information on the following day, because you would appreciate that the numbers are larger. It's a more complex operation that we are executing at this point in time, and we like to make sure that we have everything in order before we present to the public. But we have been giving you everything that have been coming up with us, everything.
Prime Minister, a question, follow-up question for you. What would have to happen for the government of Barbados to restrict visitors coming into the country at this time?
The recommendations from the public health officials and a determination that we can do nothing more to protect persons who are not working and nothing more to protect persons who are suffering. Right now, we have a multifaceted country, Emmanuel, and I think I've said that over and over. You have the luxury of asking me a question on COVID. I go back to my office to deal with every single issue in this country, from hazard pay to IMF fiscal mission here next week, to the issue of vaccines, to the Ministry of Health's issues, to some other issues we're having in the Ministry of Agriculture. I can go on and on, my brother. So let us be very clear that I'm going to give you context. The government has made a judgment. At the end of the day, we have the capacity to manage people who present themselves at the border, and we have been doing so significantly in a way that I'm happy with Dr. Bess and his officials who go up to the airport, and equally also with those who are there from the soldiers, and then those who also are in the hotels managing the quarantine. I really am going to open the books. I really am going to open the books for you, sir. So I hope that will help you when I do that with the social partnership next week.
And I have a question for Dr. Cave. Dr. Cave, can you give us a quick update on the level of contact tracing and or the results of testing that would have come back after the first death over the weekend of the 84-year-old gentleman? I know that you would have said before that some contact tracing was done and members of staff would also have been tested. Can you give us any update on how many tests were done, what were the results of those tests, and where we stand now?
That question is not for Dr. Cave. Dr. Cave is not responsible for contact tracing at the hospital. He's the clinical head there. That would be Dr. Bess. Dr. Bess?
Thank you. Thank you, Yes. You answer those questions.
Thank you, Barry. So as you know, when we have a case of COVID identified, we do contact tracing. We don't have an update at this particular point in time to say the extent of contact tracing in the case that you mentioned. There is contact tracing that happens at the hospital that is governed by the infection control team there, but that happens in collaboration with the contact tracing that happens outside of the hospital and is governed and executed by the persons working at the polyclinic, the healthcare providers.
But the first year was completed with respect to the man who died on Sunday.
Correct.
And you may want to explain further on that.
Okay.
Yeah, let me make it clear. I don't know if you missed it, Barry, but in my remarks earlier, I had indicated that there were 17 primary contacts identified in relation to the first death. All persons were tested, first test. One test came back positive, and through contact tracing, which is ongoing, as you would appreciate, that positive case was linked to the West Coast cluster, and we are now waiting to do the second test for these 17 primary contacts, but that is what I gave earlier.
Thank you, Minister, for the clarification.
Ladies and gentlemen, I want to thank you for joining us today. As I said, we will continue to keep engaged. Barry, I think your concerns on the dashboard were answered by Minister Bostic, so that even though they're trying to settle the framework, I think there was a debate on whether clusters should be in or not, but the truth is that it then becomes too complex and complicated, and the Ministry of Health will speak to the clusters. But like you, I agree that we should continue to get it out, even though the government has issued a press release every day indicating what the numbers of cases that have been found positive, as well as the numbers of tests that have been done, and the persons going into isolation and the persons coming out. But I do accept that the dashboard is more convenient for persons to look at than to read the text of a press release. So we will work on that and get it back in shape with the new format. I think they wanted to have a new look and a new format. So that's all that's happened there. Bearing in mind, as I said too, and this is important, is the same people doing everything. Is the same people doing everything. So I want the country to recognize that, like me, I have learned to exercise patience. I've learned to be able to understand that people still have their lives to live and to do other things. But I know that if we continue to stay together, we're building in redundancy where possible, both locally and regionally. But if we stay focused, we can make it and get through this. It's a marathon, it's not a sprint. Thank you very much, and God bless you. And I'm sure that many of you will want to go and watch history now with the first woman ever to have been elected as Vice President of the United States of America, and of more important to all of us, of Caribbean descent and also South Asian descent. And we wish her and President Biden, President-elect Biden, as he still is, all the very best. The world needs a strong and fair and accountable United States of America, and we look forward to that going forward. Thank you.